Hi, I'm Dr. Oindrila Dutta, practicing dermatologist in Wizderm, Shakespeare Shorney and City Center Salt Lake. Today we're gonna speak about moles in our terms, which we call the nevi. So moles usually appear as a small light brown to dark brown to very black in color, either as in a spots or a raised bumpy lesions on the skin. Generally appeared either since birth or in the childhood or can be acquired in the adulthood. So anything that we tend to see on our skin, whether it is brown or black, we call it's either a mole or it's a skin tag or a wart, but three are very different entities. In small layman terms, mole is the cluster of the cells which helps in producing the pigments, that is the melanocytes, number one. Number two, the skin tags. Skin tags are nothing but they are the benign proliferative growth which can appear anywhere on the skin. And third, that is the warts, which are highly contagious, number one. And number two, it happens mainly due to the viral origin or the infectious origin, where because of this virus needles, there is an outgrowth of the skin proliferation over anywhere on the body. Moles are basically very harmless. It can happen to anybody and it generally present in all of our bodies, whether it's since a birth, as we call it a birthmark, or it can even happen or acquired over the period of time, which we call the acquired nevi. It's completely harmless. Yes, in certain cases, do we need to do the biopsy only at certain chances where we have the probability of transferring it or converting into a cancerous cause, though the probability of transforming into a melanoma is very rare. But if one happen to see that there are changes in terms of shape, size, color, the variations and the pigmentation and the uniformity of a particular lesion, one should definitely consult a dermatologist. And if one of the features comes along, then your dermatologist might ask you to get a biopsy done just to figure it out whether it's a benign or it's proliferating to something malignant or so. First, you consult with the dermatologist. Second, you differentiate whether it's a benign or the malignant cause, and once the diagnosis has been completely confirmed, you can get rid of it with the help of a multiple procedures that are available right away. So to start with, we either remove it with the help of the electrocautery, we do the lasers, and if it's a very giant or a big mole or the ones which is increasing in size, then we can either excise it and then suture it with the cosmetic purposes so that it heals without any pigmentation and the scarring. So in terms of any cosmetic purpose, previously we used to go ahead a lot with the excision and then suture it, but now things have been changing because we have very newer modalities to treat any of the wart or the tags or the moles that are present on the body. In that, amongst all the modalities that are present, we highly recommend or go ahead with the CO2 laser. There are multiple pros that are attached with the CO2 laser. Number one, because it takes a very short amount of time. Number two, it's done by a dermat in aseptic procedures and under anesthesia, so the entire procedure is painless to you. Number three, this will be done by the dermatologist and it's a complete bloodless procedure. So once it starts healing, it heals very faster in comparison of the other modalities. Also, when it starts healing, you won't get to see any change in the skin texture or the pigmentation or the scar. So one can literally think or dream of having a complete moleless skin without any pigmentation or the changes of the texture on the body. There are few nits and bits that one needs to take care of. If it's a laser procedure, then you hardly need to take care of this area at all. All you might need to do is to just apply any antibiotic topical cream on top of it to prevent any secondary infections. And if you are going ahead with the surgical procedures, make sure that you make that area dry and keep it dry for initial 2 days, and go ahead with the suture removal procedure as your dermat asks you to do so. Once the scalp falls off, all you have to take care of is just moisturizing the area and let the skin heal and bathe on its own. If the procedure is being taken care of with the electrocautery, then the chances of post-inflammatory hyperpigmentation could have been there, but that can also be taken care with the topical other depigmenting agents. And if excision you are going ahead with, then you have to think in mind that that might require a longer time, maybe a month or two, to completely get rid of these scar tissues or the suture marks and everything. So the treatment of the mole removal, it is a daytime procedure or the office procedure that we generally call it. Hardly it will take maximum 10 to 15 minutes of your time after we completely anesthetize that area and do the procedure and cleaning under the aseptic procedures. Once the procedure is done, some patients become very apprehensive, thinking whether there will be a possibility of any new growth from that area or not. Well, let me assure you that moles are mostly harmless in terms of procedures. And once it has been done properly with the expertise into that particular niche, that is your consultant dermatologist, there are hardly any chances of any new growth over there, because we completely excise that the mole tissues or even the wart tissues, whichever might be the thing, with the help of the excision and the laser. So there is no chance of new growth from that particular area. So if you happen to see any of this uncertain and unsudden growth on your skin, maybe on the neck or the forearm or the face, anywhere, please consult me via Wizderm in Shakespeare Shawnee and the city center.